10th of June. Today is a Tuesday morning. We're going to go through week 2 concept of Classics 2. And most of us already learned Classics 1, I believe everybody. It's very interesting. Classics 1, we're talking about the cold pathogen-related conditions or syndromes, and Wen Bing talking about the fever-related clinical complaint. But that'd be great if we learn the Wen Bing in the warm climate and learn the Shanglan in the cold season. But we just keep it reshuffle, have a bit of fun. So today, based on the first slide, you can see we should be able to compare the difference or similarities between the Wen Bing and the Shanglan concept. So what will be involved, how we are going to compare this part. And do keep this in your mind. This is a very important concept regarding to your final assessment, maybe also related to your online. Is that online quiz? No online quiz. So final assessment. So what's the difference between these two concepts regarding Classics 1 and Classics 2? First, we need to have a look at understanding the basic etiology difference and similarities between them. Second, have a look at the theories has adapted to understanding or explaining this kind of two concepts. So here mentioned the 3 meanings of the regarding terms of the Shanglan. For the broad concept, any kind of external pathogenic factor attack, we call that injured by the pathogen. So Shang means injury, means injury here. Shang, so injured by pathogens. Han is any kind of unexpected pathogen. So injured by any kind of pathogen. That is broad concept. But for the narrow concept, is basically injured by external cold nature related pathogens. And the most narrow meaning is, so that means injured by cold pathogens and presented as a kind of 6 divisions like clinical manifestations. So this is more specific focus on Shanglan specialists discuss issues. But for general term, for ordinary people, we know this, for the broad concept, any kind of external pathogenic factor affect the body or injury bodies, we could say an injured or some injured by pathogens, by any kind of pathogens. Second point here mentioned in relationship between the Wen Bing and the Shanglan here. Wen Bing, warming pathogen disease theory is deeply rooted in concept from the Shanglan. So based on broad concept of the Shanglan, so no matter what kind of natures of pathogens involved, but if it's cold involved, it's narrow concept of Shanglan. But if it's broad concept of external pathogens involved heat or wind heat, or damp heat, and then the clinical manifestations will be covered or discussed in the Wen Bing concept. So some overlap based on etiologies itself and the nature of pathogens. Second point here mentioned warm pathogen disease series articulate new ideas. Because in the Shanglan, we focus on 6 division differential diagnosis. We did not discuss 4 levels or Sanjiao channels differential diagnosis. So when this basic broad concept of Shanglan has been developed further and 4-level differential diagnosis and the Sanjiao series has also been developed, and more new formula has been constructed through treating the fever-dominated conditions clinically. The last part here is the points mentioned. Warming pathogen disease school developed some concepts which were incomplete in Shanglan. So a lot of basic how disease can affect you, such as COVID-19 could affect us through the eyes, through inhaled nose and mouth. But for the Shanglan, basic only focus on Taiyang division, has not specific mentioned this kind of orifice and on the faces, only generally talking about Taiyang divisions. And that's a specific, also a kind of development presented in the Wen Bing concept compared with Shanghan theories. So here just further elaborated from the etiology. Wen Bing focus on warming or heat pathogens. So they have much more quick, fast penetrations and very fast development transmissions after infection. Because the heat is young in nature, the everything goes much more quicker than the cold types of pathogens. Shanghan here focus on affected by wind cold dominated. So they're contracting the surface of bodies and they slow penetration and with slow transmissions later on. So with heat warm affected bodies, they are going to open the portals, open the pore of the skins, very easy to penetrate in and causing further damage of internally, resulting high temperatures and body fluid leakage and qi leakage. But for the cold winged pathogen, they constrained and causing sealed of the pore, resulting qi obstruction, aching pain will be dominated. So that's slightly different based on nature of pathogens here. Second, for the pathogenesis. So what kind of the body reactions changes after exterior pathogens invaded in bodies? We know Wen Bing basically focus on the entry door both through the mouth and the nose and through the lung channels, lung systems. And Shanghan theories focus on the Taiyang divisions through invaded pathogens penetrated through the gaps between the skins and the muscles. So any kind of the weakness in the skin and the muscles is very easy to be trapped by the cold pathogens and lost in the channels of Taiyang divisions. So it's a different pathway regarding to pathogenesis. When the warming pathogens go through the orifice on faces, because all these kind of portals are completely open with no restrictions. So with the young in nature pathogen, that means it goes very smoothly and very, very fast, can cause very serious damage in very short term. But doesn't matter how weak your skin, your muscle is, when the pathogen trapped in the surface of Taiyang divisions, the transmissions, invasions takes a bit a while. So they're struggling a little bit. So you must suffer very noticeable aching and pain for a while and until the pathogen penetrates more internally, causing trouble and organ disorders internally. So much more longer durations for transmissions of pathogens in the Shanghan. Pathologies and progressions. So part of the already covered for Wen Bing because the portals all opened and very easy injury body fluid and yin for the Shan, and due to trapped in the channels of yang divisions, very easy to injury defensive yang qi in the surface once they transmitted internally, and very easy to damage the yang qi inside of organs. So from this kind of comparison, you can understanding why the fever could be part of the clinical manifestations. Because so fast, the injury yin straight away, so when the yin is insufficient, relatively yang will be relatively dominated. On top of that, with yang pathogens, so fever obviously should be dominated. But for the Shanghan concept, Shanghan theory, Shanghan conditions, and it's cold dominated. In the surface, they're already constrained qi and blood circulations and causing poor circulation of defensive yang qi. When they penetrate internally, it's going causing damage and clashes with internal functionalities of organs. So all of that are explained or predicted through clinical manifestations. Like one of the previous students asked, how do you know this has been happening like this or that? Nobody actually exactly can see it happening. So what they can try to predict through the progression of clinical manifestations. So such as for Wen Bing, so they had a fever straight away, comes very quickly, and feel thirsty, sore throat, And they may have slightly intolerance to food at the beginning, but a very short duration, very mild, so very mild intolerant to cold complaining, very quickly have elevated temperatures and sore throat, and cough with thick yellow sputum, and the thirsty complaint can come out straight away. Rapid pulses and red tongue body, red tongue tips will come obviously. On top of that, if it's still in the wee level, and floating pulse will be coexist at the same times. So up to this stage, you still could call that as a Taiyang division disorder, but they do not have aching pain as dominated. Instead, they have high elevated temperatures and rapid pulse on top floating pulses. But compared with the Shanglan you learn in the Classics 1, and with external cold dominant pathogen invasion, because the cold resulting constructions or constraints of the channels or Taiyang divisions, so aching and pain will be dominated due to poor qi and blood circulations, and with very mild level of elevated temperatures. So fever is not dominated, and aching pain intolerance to the cold will be major complaint. And they'll never have thirsty complaint, never had rapid pulse. Instead, they have floating pulse with tight pulse, floating and tight pulses due to constraint of qi and blood flowing. Now, any questions regarding to this kind of Shanghan and Wen Bing concept comparison? Okay. And details of there's question is what will be covered regarding the exam look like. Exam will be looks like all the other subject exam, multiple choice and short question and major question and one case study. I will give you a list of the, if the exam it is going to go ahead at the end, I'll list of the information and you should prepare to focus on. Should be very, very simple. So don't worry too much about that. We still have many, many weeks to go. Thank you. Now, for the treatment regarding to both Wen Bing and Shanghan, because the fever is dominated for Wen Bing, so cooling aromatic herbs will be introduced at the beginning in the wee level to enhance perspiration. Still similar, diaphoretic will be introduced as a major therapy. But for the Shanghan, you cannot use cooling, but you still use an aromatic pungent, but warming aromatic to enhance perspiration. So in the earliest stage, wee level, both Wen Bing and Shanghan will be adopted using diaphoretic method to enhance perspiration, and just using different nature of herbs. It's cooling and one is warming. Both of them are aromatic. So which is matched with what is dominated. Now let's have a look second part of these informations today. Okay. So after comparisons between Shanghan and Wen Bing in general concept of etiologies, pathogenesis, and treatment. Now let's have a look details what new has been comes out through the development of the Shanghan when up to the Wen Bing's practice in the Qing dynasties all along the way. First, let's have a look the 4 levels. We're all already familiar with 4 levels through the diagnosis and pathology study in the first 1 or 2 years of journey. First level, wee level, is also called protective level, which have a lot of similarities regarding the Taiyang division we learned in the Classics 1. Which is mostly young aspect of the qi in the wee level, and this kind of qi from the information provided in the notes that says is formed from and gran's qi. So that means from the middle jiao's digestion systems and corresponded qi, and which have very strong connections with lung systems and circulated this wei qi circulate between the blood vessels and surface of bodies. So they basically traveling the wei qi traveling in the surface between muscles and the skins. So they keep them warming about the surface from tier of the bodies and to try to maintain better circulations internally as natural protections. This kind of Wei Qi is very important in a way to determine, in one way, is what ability we have to able to coping the living in the fluctuated weather the temperatures, fluctuated weather, fluctuated environment, and how strong of the yang qi internally based on 6 divisions, and will be determine how strong the Wei qi is going to present it. So from the 6th division of Shanglan, which is correlated with overall fundamental yang qi, from the theoretical yang is sourced in the kidney, so Wei qi in some level can be determined to measure how strong your kidney qi will be based on Shanglan. But based on 4 levels, and they do not mention about the kidney yang qi in this concept, they only mention about how strong your lung qi and will be, and then how strong your Wei qi, protective qi, will be presented. So if you are very easy getting sick, from 4 levels, they say, oh, you don't have a very strong lung qi, your immunity is weak from conventional term. But in the Shanglan, getting sick so easily, people could say, oh, you don't have strong kidney qi because so easy getting sick. You don't have protective abilities to avoiding any illness. So this is similar in a way based on using different theories. So example, for cold weather, you can always see me wearing a lot and less and less clothes, like today also wearing big. So based on Shanghan, you say, oh, you have very poor kidney yang qi, not able to warm in your body. But based on Wen Bing theory, you say, oh, your lung qi is not strong enough. You need wearing a lot, protect yourself to be attacked by external pathogens. So this is in some way have overlap and focus on different angles. Now, second level, when the Wei qi have disorder or any kind of Wei qi disorder symptoms comes out, after resolving Wei qi disorder conditions, no negative impact, or we call it no scar tissue, will left on your bodies. And people could have no memories about that, especially children. After external attacking and in Wei level disorders, they could not memorize anything. They have been sick. But when the problem go to nutritive level, if the Wei in the Wei level body are not able to eliminate pathogens, and the problem go to nutritive level, why they skip the qi? Are they? They skip the qi, are they? Second level should be go to qi level. So Wei level and the qi level. So I missed the qi level in these slides. Any of you missed the qi levels as well, or just me? I missed qi level. Anyway, after Wei level should go to qi level. Qi levels talking about organs, functionings. Okay, they should have a qi level. Somewhere is missing. I'm sorry, I did not check that. I did not find that. Thank you, everybody. Okay, I'll put additional qi levels for you guys to supply the information missed. I'm sorry for that one. Now, qi level, after Wei levels, they are not going to affect any kind of organ function at all. So only in the surface. But after Wei levels problems cannot be resolved and pathogens can further penetrate into qi level. Qi levels, we're familiar with the big 4. So high temperatures, big thirsty, and pounding pulses, and big sweating. So like Bai Hu Tang syndromes. So big 4 levels conditions usually indicate disorder of organs. So functional disorder. And they should not have any kind of structures changes. But once the qi levels conditions cannot be resolved by itself or with help, and problem can go further deep in, go to nutritive level. When the pathogens involved in nutritive level, the structures will be altered, or we call that the body will left behind with very bad scars or negative impact after nutritive level has been affected by pathogens. You will memorize it for the rest of your life. Never forget it, physically and mentally, for nutritive level invaded by any pathogens or cause any kind of disorders. because nutritive level, basically, you can see yin qi, nutritive qi is used to nourish the body. If the yin qi has been injured, damaged, nothing can nourish the body. Can you have better development body? You can't. And also this kind of yin qi is part of the contributions of the gu qi, the grand qi. And this specific nutritive qi forming part of the structures of the bodies, which also circulate within the blood vessel. So you can see they're forming part of structures for the bloodstream. That's why they circulated in the blood vessel and nourish yin and yang organs internally. Without the nourishment of yin qi, your organ become malnourished. The structure will be altered, will be changed. Yin qi also have very close relationship with the heart, and which supporting produce of the blood. Now there's a question: is it similar to the blood plasma? Okay. Now because it's a qi, it's a more energetic natures of the bodies there, and not necessarily related with one or another of body constitution components. But when I mention of structure damage, it depends what kind of clinical manifestations. So if people have leukemia, people have a cancer, people have skin disorders, and they're based on clinical manifestation and shows any kind of injury. I hope this answers the questions. They may be related with blood plasma, the blood disorder involved conditions. Maybe due to lesions caused the skin, you can have very bad pigmentation, scar left behind. Maybe due to organ injury, such as hepatitis, and after have nutritive level clinical manifestation comes out, they can see very bad enzymes indicated in the bloodstreams, and organs has been disturbed for the liver organs. Does that answer the question? And if it's happened in your heart, you not just feel the palpitation. In the ECG check, they can show certain damage for the heart muscles and heart cells. And the poor blood supply could also indicate it in the ECG and checkings after have examinations. Now, nutritive level injury or disorder is quite very severe conditions for the individual people suffering, and also not very good signs if it happened for the individual bodies as well. And most severe one is if in the nutritive level, qi level problem cannot be resolved and heat become exuberant, much more aggressive. They can penetrate in to both nutritive and blood level, or go to blood level, causing serious bleeding. And this kind of bleeding usually in very concentrated fresh blood comes through, and very serious organ and structure and dysfunction and damage, and usually causing very serious conditions, go to emergency for the Wen Bing conditions and need a serious specific care as well. So here mentioned, and blood is important nutritive material for the organs. We all know that. We only have certain number of volume of blood in our bodies. If we have serious hemorrhage happening, we can lose a lot of proper functionings. For myself, in my past years' experience, when I lost the serious one, I lost a very big amount of the blood. When I was still conscious, I looked like ghost. The whole face is pale. My lips, my nails all looks purple. So when the second person comes, looks at me, they get shocked because I look like ghost. Complete no blood shows my face and my lips. When I check my tongue afterwards, my tongue looks like has been washed through days and the days soaked in water. So basically no colors present, very serious. And blood also forming the nutritive is a part of the structures and composed by both nutritive qi and body fluid. So once a serious blood has been leakage, you have no nourishment for the body fluid and shows very serious dehydration and no proper circulation in the nutritive qi inside. You're very easy to feel dizzy. You don't have proper organ function can perform. Blood also circulates in blood vessel. When serious blood leakage or blood disorder occurred, and either bleeding comes through or poor volume blood circulate blood vessel, they are very feel the pulses from checking the qi itself. Now, spleen is the basic origins of the blood producer manufactures, and heart governs blood circulation. Liver as regulated and restore the blood, like reservoir of the blood. Lung helps distribute it, and the kidney essence supports. All the 5 organs in a way have specific contributions and to generating, circulating, protecting, consolidating, and restorations, controlling for the blood circulation and producing. So you can see why the blood level disorder is the most severe conditions for internal organs and for the human beings. So 4 level, Wei, Qi, Yin, and Xue. Both Wei and Qi disorder have no serious structure changes damage, but when the Wei level is involved, you even could not memorize as an infant, a little baby. When Qi level disorder occurred, you're going to have organ disorders and very bad suffering if the high temperature is so high, but still could recovering looks normal. But when the nutritive yin level has been affected, you definitely have serious scar, very bad damage will remaining for your organs. When blood level has been affected, all the organs in your body will be affected in both functional part and structure part. It's the most severe one. So that's basic summary to go through. Now, Wei level is the first initial level has been by external wind heat pathogens. And after they transmit into Qi, after the Wei level cannot be resolved, they can go through transmission, go to Qi level theoretically, or they can go to both Qi level or nutritive level simultaneously. If the Qi level problem cannot be resolved by itself, I'll use a different color here now. If the Qi levels problem cannot be resolved by itself due to exuberance of heat generated in the Qi level, because Qi level 4 of the energy is there, temperatures are usually very, very high during the day, and then they can further transmissions and go to nutritive level and damage structure as well as affect the functions. And they could deal with both or affect both nutritive level and blood level simultaneously. This is causing more severe condition. For some, there is serious virus infections. 3 Qi Yin blood level could be affected at the same time. But for some skin disorders, you could have Wei, Qi, and nutritive levels, like psoriasis, is very commonly presented at once. So it depends what kind of condition you can deal with. Because psoriasis is not called Wen Bing, but we can adapt or using Wen Bing theory to deal with symptoms management in the psoriasis skin disorders. So that means for the psoriasis, we still can use basic concept of Wei, Qi in the Yin disorder, related skin rashes, itchiness, and red patches, and the poor circulation nourishment for the skins, using the same concept of treating for the treatment. So here's the basic pattern. We already learned that from the pathology. Here, just have a bit brief and quick review. For the Wei level disorder or Wei symptoms, basically is a stagnation of protective Qi. So because the Qi is trapped in the Wei level, and they're going to have very noticeable fever at the same time, simultaneous with chills and intense cold. But the fever is much more than chills and the fevers. And they may have slightly thirsty and slight sweating or not noticeable sweating, and still have possible sneezing, congested nose, slight sore throat or cough. And most importantly, pulse is rapid and floating, and redness around the tip and possible tip and edge. So these are typical signs and the symptoms for the Wei level in Wen Bing. For Qi level, here did not miss Qi level. So for Qi level in Wen Bing, in 4-level differential diagnosis regarding the symptoms, heat will be exuberant. So there's excessive heat internally causing elevated, very high temperatures. At the same time, because these high temperatures resulting injury of body fluid. So one is heat, second is noticeable fluid injury resulting sweating and thirsty. And usually they have no more intolerance to the cold up to this stage. Instead, they have intolerance to the heat. The heat. They don't like heat. They prefer to drinking icy cold, using cold pack on their body to control the temperatures. And with the heat generated profuse sweating, so you can have noticeable body fluid injury, obviously, and thirsty could present as a kind complaint. When they stretch the tongue out, not just redness on the tongue, it shows very noticeable dehydrations on the tongue, and may also come with yellow thin coatings as well. So pounding rapid pulses or slippery pulses what comes out. Now slippery not always means a damp flame. Slippery here is due to heat causing speed up and blood flowing very smoothly. So this slippery as well. So when the flooding or rapid goes together with slippery, this tells you heat is so dominant, causing and speed up excessive circulations in the bloodstreams. If the chi levels conditions cannot be resolved, the next level is nutritive disorder, and these will involve the unconsciousness or disturbed conscious levels, and some people have mind disturbance, comas, so they usually spirit or heart has been affected, obviously, and very, very severe, and dehydration will comes out. So instead of fever elevated during the day, up to this stage, fever is mainly happen at night. So during the daytime, especially children look still normal, they're chatting, they're eating, have fun. But at night, the lips become looks like a cherry blossom, and very, very red and fresh, and the whole face is even getting red and very dehydrated and very, very hot burning. Thirsty, but no strong desire to drink, because this time heat already burning the bloodstreams. So in a way, they feel thirsty, but no desire to drink, because heat is not in chi level, heat in the inside of nutritive level. Heat is burning your bloodstream, so some part of the body fluid still be steaming up. Insomnia, irritability, restlessness, or muddled consciousness, and usually they get partially unconscious in some level, and some people even speak very funny, so they call it delirious speech. For children, very bad skin rashes comes out, especially related with virus infections, and pulse very rapid, thread very thin due to damage of body fluid, and very crimson red tongue body, lack of sufficient tongue coating covered, what comes out. Now there's questions. If the patient has weak pathology symptoms, but the pulse is deep, do you look for other symptoms? Depends on the constitution. It already defined as weak pathology is weak pathology, which means they do not have a strong constitutional chi as a kind of precursor. And the deep pulses only have meanings when the deep pulses, thready rapid, goes together with what? Crimson red tongue body indicating nutritive has been affected. There is a second question. In practice, what are the main difference in the presentation between yin and shear level? Bleeding. Bleeding is a dominant and significant important key points for pathogens that go to the blood level. In the nutritive level, there's no bleeding. Most dominant is crimson tongue bodies. That's why this Wen Bing concept can be used dealing with chronic skin disorders when people have crimson tongue bodies, have lots of redness and itchy patches on the body, shows in the redness, typical nutritive yin has been affected, but there's no fever. It's due to autoimmune disease. You can use a similar formula to treating that, treat it as a kind of heat. We call that trapped heat or congested heat in the nutritive yin level. I hope this answers the question. Thank you. Now, this is very typical image, and we're already familiar with from different presentations here. And first and second, they all presented skin rashes. If the rashes is a scatty, If in the weak level of the heat, wind heat causes some mild virus infection called skin rashes, and the rashes is not that intense. For this kind of intense, the heat comes through is very, very severe. And symptom comes out combination with the Wei, Qi, Yin, 3 level simultaneously as a clinical manifestations. Especially in a tongue presentation like this typical strawberry tongue color and presentations, you see all these kind of thorn, bulging-like of structures on the tongue, and very, very, some people complain, very painful and burning. And still at the bottom part of the tongue, you can see here, indicated what? The lower jaw still have some level of coldness. So in some way, from some handling depth, the kids does not have a strong constitutions. That's why overly reacted to the immune responses and by trigger from external virus. If you do not have this kind of tongue coating shows in lower part here and present with all the other symptoms, that means the strength of virus is so strong, affect everybody, no matter you have or weak constitutions. The malar flushes or redness on the cheeks indicate some yin level has been YIN, yin levels heat presentation. If it's only happened at night, it's typical presentation of YING, nutritive yin level have too much of heat. But overall, with the tongue combination with the color of the lips and the color of the faces is typical, and nutritive yin level has had heat pathogens attack. It's not very common happening for adult. This kind of nutritive yin and attack by the external pathogens is very, very common happen for the young children. Now, for the blood level syndromes, and when we know in a way Qi yin level pathogen cannot be resolved, and you show any kind of patient show any kind of form of bleeding, fresh bleeding, and you know problems is very likely to go to the blood level. So excessive heat affect the blood, causing boiling up the blood. They change the permeability of blood vessels. Very easy have fresh blood comes out, which coexists with fever. And due to this kind of excessive heat in the bloodstream, can causing high concentration blood because the body fluid has been evaporated. The red blood cells, all the blood cells become more condensed, result blood stasis, coagulations. So restlessness, agitations, and all the mental disorders, or not disorder, mental dysfunction, delirious speech, maniac, coma can come out at the same time, shows different level of bleeding. Most common one for children, bleeding from the nose, some bleeding from the gums, and more bleeding for the adult. And if bleeding from ears is very, very dangerous and could be causing death. And it's not very common, could happen for some people. And bleeding from urine, from stool, usually is for the adult. And this kind of serious skin rashes, maculopapular rashes is very, very unpleasant rashes comes out for the children. When you see that one, and this also can happen for adult. Actually, we have one of the former students' father had this kind of rashes comes all over his bodies after has been bitten by a mosquito, and very scary. Of course, ended up in the emergency. They had specific caring for him, recovered many, many weeks later. What is a tongue should look like for the blood has been affected by the heat? So that means you already have crimson tongue in the nutritive levels, yes? Up to this level, just become much more dehydrated, have a lot of serious cracks, and the pulses getting much more deep, weak, and more stickier. In a way, we call that lack of proper flow. So get much more hesitant pulses. Could be irregular, could be missing, and could be more deep levels, more dehydrated, serious dehydrated, less proper flowing. So more condensed blood cells, structures inside, less volume of blood. So this obviously you can go through these predictions, more hesitant and possible irregular missed pulses, more deep and more thready pulses there. So that means for the pulses at that stage, it's not as severe as presentation bleeding and serious big patches of skin rashes with red color and emotional spiritual disturbance. So that's the difference between Shanglan and Wen Bing. So here you can see more tongue and skin rashes focusing compared with pulse focus for two different theories or different. This is repeated against the progressions of Wen Bing disease. Basically, this is a kind of the from left to right is further deterioration of illness and further invasion transmissions of the pathogens there. They could singular transmission from one to another, and they could combine one. They could combine one to another, and they could have both simultaneously. Qi and nutritive level, or from Qi they could have nutritive in and go to blood, or they could have three at once for specific skin rash related concern. So they still have itchiness and they still have floating pulses. Everything goes so fast, suddenly have something crimson tongue bodies goes very quickly, and not just high temperature during the day, also very horrible high temperature at night. So there comes everything at once. Same for the treatment. If they precede as kind of nutritive level conditions, how we are going to treat in a way, we need to what? To vent the heat upwards. So we vent the heat from deep level upwards. One level up, and then slowly can vent the heat up and up until diminish it. If the heat in the deep level cannot be vented up, they'll become congestion heat or embedded heat or latent pathogens trapped in the collaterals. Like all the emotions, and emotions come from mentally changes, but these trapped pathogens come from external invasions embedded internally. So this is slightly different, but they're all trapped in collaterals. They cannot be eliminated on time or properly. Now, any questions for these two parts of the concept, or are they too fast? Because this basically we already learned from the other previous two subjects. This is very brief review. In terms of treatment, here is the questions. In terms of treatment, are they all venting up and out for all levels? Theoretically, yes. In reality, regarding to skin disorder nowadays, by utilize Wen Bing series, definitely. And for the Wen Bing itself, in treatment, yes. Thank you. And why is there slippery pulse for the Qi level? I explained it previously. Slippery pulses is not just means a damp and a flame. Slippery is a kind of shows the speed of the flow of liquid. When the liquid flowing so fast, which will be mimic similar presentations or experience for you to experience the dampness and the flame, because when it flows so fast, they have hesitation. They have a kind of a collisions between molecules to molecules in the water. So that's why, example, maybe this is not proper example. Everybody watch the news. What's happening in America? Yes, they have demonstrations for one or two or maybe mix of different reasons. And when they follow the one directions flowing of all the human paths and no obstructions, and this is we call this a smooth flow. Yes, but if they have obstructions here, it's okay. They can be steady the flow. But if these obstructions also have against the flow, can this part goes backwards smoothly with additional goes forwards? They're going to have hesitation. Same for the blood. Once you have so fast the bloodstream, but you do not have smooth flow for the blood itself, they're going to have a kind of similar conditions, similar like flame obstructions in the middle. So you're going to have slippery pulse. Does this answer the question or just make it more complicated? Now, when the blood has been affected by heat, does the body fluid work become leakage from heat? Yes, because the blood is been boiling by heat, yes? When the body fluid has been leakage or get injured, does the blood get more stickier? When blood get more stickier, does it mimic like a damp and flame? So that's why when the flow in the blood level, they can be like that. How about in the chi level? In the chi level, because the heat still exuberant, they still can result in body fluid leakage. So in some way, indirectly, when body fluid has been leakage, part of components of the bloodstreams will getting partially dehydrated. So from this explanation, it could result in similar of sticky or dampness scenario and resulting slippery pulse. I hope this answers the question. Probably this is a better one as an example. And there's another question is, what was the pulse on a blood level pathology attack? Just to confirm, thank you. Okay, we already discussed it. For the pulses in the nutritive level is very deep and thin already due to what? Heat inside the blood level affect nutritive chi. Same when heat go to the blood level, affect the blood we can become more concentrated, so they can less volume in the blood, you get very thin and deep. At the same time, they are going to be hesitant to flow. So they may have irregular pulses or hesitant flow, and you're going to have very possible slippery and weak pulses indicated, but a little bit fast as well. So go through basic predictions you can find, even they did not mention specifically, but the most important, bleeding correlated with high temperatures with traceable external attack as go to blood level. Thank you. Yeah, internet has been trouble sometimes. So there's question, both damp and heat can cause, yes, both damp, so damp, flame, and heat, excessive heat, not simple heat. Both damp and excessive heat can result in slippery pulse. Yes. Thank you. It's good if we have questions can help all of us to understanding and to stimulate my brain to think it through, give you a proper example. If any example explanation is improper, just let me know. Sorry for any disturbance if I mention anything else as unnecessary. Now, here is talking about pattern differentiations in regarding to triple burner. And I will give you a link. How many of you have been a member of the ACMA? Recently, they have a free seminar talking about specific modern explanation about triple burner. Yes, and that topic is excellent. So I'll put the links in my class message. So if anyone have further reading or watchings, that is good one to help us understanding the triple burner in some levels from different angle, different perspective. So based on information provided in the slides here, and here mentioned, the triple burner has been used as a guide for differential and tracking the process of symptoms transformations affected by damp heat pathogens. If it's only by heat attack, we're using 4-level differential diagnosis in Wen Bing. If it's affected by both heat and the damp, because it affected basic chi and body fluid distributions and transformations, and we utilize triple burner and differential diagnosis to explain it. So which will involve upper burner, middle burner, and lower burner. So let's have a look what will be discussed in the following slides. We all know, based on the previous subject study, basic understanding of triple burner. For upper burner involve the lung, organs, and the heart in some level regarding to clinical manifestations. In these slides, I also try to emphasize specific upper burner patterns. So first, let's have a look at the lung patterns. So external pathogens especially damp heat, attack the lung qi or wei qi or lung systems. So attack the surface based on triple burner. We call that less severe level of the body. Upper burner, lung, and wei qi has been affected. So ended up lungs qi is not able to perform proper DD function. So dispersing, descending ability has been affected. So if they cannot dispersing, you are very easy suffering chills and fever. If they cannot descending, you are very easy suffering wheezing and cough. So fever, chills due to dispersing function has been affected by the pathogens, and same for the aversion to cold because the lung qi is not able to perform self-protections and the defensive yang qi felt too warm, and slightly or no sweating. This depends how strong external pathogen and how strong anti-pathogen qi for individual bodies. Nasal congestion is quite a common clinical manifestation for lung qi disorder, which correlate with sneezing and regarding to cold dominated or damp dominated. But if any heat pathogens involved, sore throat could be part of clinical manifestations. So if it's both damp heat affected, there could be combination suffering both nasal congestion sneezing as well as sore throat, especially if people have precursor of sinusitis issues. These are very common presented simultaneously. Headache could be part of the dampness as yin pathogen trapped in channel, resulting in channel obstructions. It could be presented. Cough is due to descending lung qi not able to perform their activities. So cough could be also presented. Thin white tongue coating is typical external pathogen attacking the surface. So no organ has been affected. So no organ has been disturbed. It is still either normal or internal constitution don't have a strong protective yang qi. Red on the tip and edge indicated pathogens have some level of heat in nature. Rapid is correlated with heat in nature. Floating tells the surface. So this is a combination of damp heat resulting in this kind of clinical manifestations. If it's only cold, there's not much of the heat signs present on the tongue. If it's only damp, there's not much of a heat. Sorry, if it's only damp, cold, there's no heat signs present such as sore throat, rapid pulse, red tips of the tongue. If it's only damp and cold, but if it's only heat, there will be no more aching, pain, or congested nose as dominated and present in this group. And there's two types of pattern in upper burner patterns. One is stagnation of the wei qi surface. So these are more congestions and aching and pain dominated. Second is, and the lung function has been affected. There's more cough and wheezing involved. So this really depends on your constitutions. So if your kidney qi is so weak, very easy have a lung function disorder straight away, suffering wheezing and cough. If your constitution is okay, maybe aching and pain will be dominant and maybe a little bit sore throat as well. Now here's the questions. How do you differentiate when someone has a cold invasion rather than Wen Bing, but an underlying heat conditions? Will that show up in the tongue? Okay. Now if patients have underlying heat constitution, you're not very easy to be affected by the cold pathogens. And instead, you're very easy to be affected by the heat and wind attack. But if you have a cold constitution, very easy affected by wind heat pathogens from external. So we are attracted what we are in a way to forming specific unities. But in some occasions, there could be happening, like the kids have very, very poor and spleens yang qi, especially infant. They have not built up their strong immunity when affected by a virus such as the very bad COVID-19. They can cause a horrible Kawasaki disease that is typical is contract. So if that happening, usually the condition is very, very severe. They're causing very, very chaotic. And if any of you remember last term, I showed the different kind of strawberry tongue in the session, the clinical Collaborate session, that tongue is still strawberry tongue, but not as red as today's strawberry tongue image. That tongue shows a lot of watery tongue bodies and very, very poor springs yang qi, at the same time affected by external pathogen. Same for today's strawberry tongue. We showed just a minute ago, the bottom part, the rear part of the tongue coating is white, but all the front middle part of the tongue and crimson red, which tells you constitution, they don't have a strong yang due to weak physical body. But due to extremely strong strains of pathogens, yes, you still can causing and serious damage. But if it's happening, they're not just in the Wei level, they go to Wei, Qi, nutritive level simultaneously. Very, very severe. But it's good. It's a good question to make me think. Thank you, Lucy. Now, upper burner pattern here mentions specific early lung patterns involved. So fever, slightly aversion to wind or cold, and cough, and the pulse is more rapid and floating. So they may do not have a typical and other young conditions. Fever must be more dominated than aversion to cold. On top of that, with combination both rapid and floating pulse. So it's typical wind, heat, and pathogens involved. So it can be covered, this can be covered in Wen Bing, but not necessarily using triple burner differential diagnosis. We can use in 4 levels because only in Wei level. So that means upper burner pattern, and it's similar like Wei level pattern and similar as the Yang Ming Wei level in 6th division. If you mention that one, if you did not mention that, just skip this concept I mentioned. Now for upper burner pattern again, and this upper burner pattern is much more deep levels. So in the Wei level, upper burner more Qi levels, so fever more dominated, as well as other big 4 conditions. Excuse me. On top of that, you can see they have an organ dispersing and descending ability affected by a lung. That's why it shows early stage of pneumonia, or it's going to become pneumonia-like conditions. So cough and wheezing will coexist together with high temperatures and profuse sweating and enormous thirst. And very, very pounding, rapid pulses and what comes through, as well as a yellow tongue coat. And there's this question about sweating. Now, sweating usually comes out when the problems affected by the wind heat. If able to sweating in Wei level, usually not very easy for the pathogens further penetration, go to Qi level. Unless you only have mild sweating and pathogens will be still strong, they can penetrate in Qi level. When the pathogens penetrate in Qi level, definitely they are going to have profuse sweating because much more deep level and heat become exuberant, very easy, injury the yin and open the portal and all the leakage of fluid will come out. Another question, why did you mention about the pneumonia? Okay, all right. When you have a fever, profuse sweating, cough and wheezing, big thirsty, and as a kind of practical doctor, what are you going to worry about condition that can cause death? Which one? Is a bronchitis causing death or pneumonia? Pneumonia is the most common conditions can cause death for elderly. So that's why I say this could be the pneumonia. So you need to eliminate anything could be possible serious conditions in conventional term to save the client, to treat the problems and on time. So you always need to think about most severe conditions, slowly eliminate it and try to save the conditions and reduce suffering and symptoms. Thank you. There could be something else, maybe just asthmatic with newly contact infections. So when asthmatic have newly infections, so this is go to not infection the sore throat, this infection where? In the bronchi. So maybe chronic bronchitis, that is okay. But if you already have acute severe bronchitis with ongoing asthma, you're very easy possibly have organ disorders very badly. When people could not breathing, they're going to die very easily. So be careful, treat it carefully up to this level. When the wheezing, cough, correlated with high temperature and profuse sweating. But when the pulse still pounding and rapid, you know they have very strong defensive ability, still very good antipathogenic chi. They're fighting very strongly. When the pulse is rapid, getting very, very weak, that is much more crucial, much more serious. There are some old ages people, when they clinically presented proved by X-ray as a pneumonia, they do not have typical very high temperature. They do not have typical profuse sweating or very noticeable severe cough and wheezing, but they do have underlying previous pneumothorax or chronic bronchitis conditions. But when you check their spirit, they show fatigue and lower spirit. You need to pay enough attention. And old people when they're suffering pneumonia, they don't have typical clinical manifestations, and they can very easily losing the time to getting proper treatment and resulting sad consequences. Now, after V level and Qi levels lung pattern, still in upper burner pattern here, talking about the lung heat. So what's the difference between this lung heat with previous lung Qi level pattern? So these have much more. This is further deterioration of inflammation in the lung. So previous I say could be possible earnest pneumonia. So when you have yellow-green sputum, especially if the sputum from yellow become rusty, that will be typical clinical conditions indicated, and organ of lung tissues has had very bad damage. Definitely, lung tissue had very, very bad inflammation. But up to this level, still could be bronchitis, because only yellow-green sputum in the windpipes of the lung has not affected the lung tissue yet. When the mucus become rusty, yellow color, the lung organ have inflammation. It's more severe. So this is the windpipes only. This is triple burner, and they adopt both triple burner with 4 level based on the information here. But this is not 4 level, so they mixed everything. But they still called upper burner conditions. The problem happened related with lung organs and the lung systems. So this tightness in the chest tells occasions of the lung affected. Thirsty tells the heat is exuberant. Damaged yin, red tongue, yellow coating tells a problem patient is not in V level anymore. In the Qi level, go to lung organs and rapid pulse. So this is much more severe conditions compared with previous lung pattern in the Qi level. So this is go to lung organs. So when the lung system V level is in the surface, lung Qi level, early organ dysfunctioning. When you go to lung heat, partially lung organ tissues will be involved. Now, still upper burner. We know the upper burner involved the heart and the lung, but because heart is not very easy to be affected by external pathogens, they have outside memories. They call the pericardiums. So here talking about when the heart has been affected, first will be response as kind of pericardium disorder. So this pericardium disorder affected by external heat pathogens will present a noticeable fever and muddled consciousness. So Shen, spirit has been affected, and possible delirious speech or coma or sub-unconsciousness. If this happening, and also when you try to check their tongue, they're not able to stretch the tongue fully. They feel the tongue more stiff. So that's why I shorten the tongue, and they may have troubles and with the spit out of mucus, and you can hear a lot of noise in their throat, and lots of muddled sounds comes through, and these are typical pericardium obstructions. Up to this level, usually go to emergency. And if it happens at home, we can do acupuncture at the same time, call the ambulance and make sure they try to keep them awake if they could as possible, using emergency points, either acupuncture points, stimulation, using the points on extremity to keep their conscious remaining. They could have very, very cold extremity due to suddenly and the pericardium affected is a kind of shock, and as a self-protection, all the bloodstream is go to the central part, important organs, remaining the extremity have poor blood supply. But the most important, the tongue become deep red or crimson red, very severe due to lack of oxygen, and very thin rapid pulse sustain. We don't have any chance to see this in the clinic. If you have a chance observing the hospital one day here or overseas, you may have a chance to see that in the emergency department. It's very scary. You never forget it. When you only need to see once, you never ever forget it. And they can, like a movies, come back again and again and again when time's ready. It's very, very serious, very, very horrible things. And their face looks very horrid. Now, after up burner, here talking about middle burner pattern. Middle burner involved the digestive systems, and stomach, large intestine, spleen here has been covered. And this is further deteriorations of the illness, upper burner conditions. So if the lung disorder cannot be resolved, they usually further deterioration. But if the pericardium pattern cannot be resolved, we are in the heaven. So that means only come from the lung disorder without proper caring and proper resolving. But they could also directly attack from external damp heat or some heat attack. And especially when heat is dominated, they can go to middle burner straight away, either from food contaminations and from food contamination or just from heat, excessive damp heat and loss in middle burners. Depends on the clinical manifestations. Now, Yang-Ming pattern here, have a look, excessive heat in the stomach. So we know this very simply. And big fever, heat aversion, flushes face, thirst, laboring breathing. So when the laboring breathing comes out, if people haven't do any physical exertion, do be careful checking their lung function and heart function, because they could mask or could very easily confuse with something else. Laboring breathing should not be happening at all if people do not do physical exertions in the hot season or in the normal circumstances. So be careful about this happening, especially people overweight in middle age. They could have lung organ troubles if they have asthmatic previous conditions or previous lung conditions, or if they may have trouble with their heart. Yellow and dry tongue coating, typical signs tells you heat has what? Injured the body fluid in the qi level, in the Yang-Ming qi level. Flooding, slippery rapid pulse is typical signs tells you, and damp heat exuberated in the Yang-Ming levels. And this could be in the channel and could be in the organ. If the constipation is correlated, tells you in the Yang-Ming Fu organ, large intestine. If the only first few could be in the channel levels. So that means this part is partially overlapped with what? 6 division Yang-Ming divisions. And continuing middle burner pattern, here talking about a combination, spleen, and a stomach pattern. So if fever is unsurfaced or contained or unresolved or trapped, or we call that is a kind of fevers only happen in late afternoon, or they feel hot feverish, but when you measure temperature, it's not very, very high, maybe just slightly above 37, but they feel very hot and feverish, very red on both sides of the face, cheeks in the late afternoon, especially heavy and tight and in late afternoon, or some people's after eating and drinking. They feel so heavy on the body, exhausted, and very red patches comes out on the faces and feel feverish themselves. And can have fullness, distension, sensations on the chest or epigastric regions, especially when you ask them to do deep breathing. They say, oh, so difficult. They are a little bit struggling, but not as severe as a laboring breathing. At the same time, they also have rebellious qi, result in nausea, vomiting, and poor TT function shows loose stool. If loose stools have very bad odor or very full smells comes out, you know it's kind of contamination related food, the eating or damp heat has been affected in the middle gel straight away and result goes through upper burners. Greasy tongue coating, typical signs tells us it's a damp, we know that one. Usually tongue color will be more red, and soggy, slippery, moderated pulses, and possible submerged. Reason they have submerged is due to damp is trapped. Damp is trapped and affect the proper circulation of the qi in the blood vessel. That's why there could be submerged pulses. So this typical damp heat pathogens resulting dysfunction of spleen and stomach presented these kind of clinical manifestations. And this is quite common presented in food contamination in the summer, or people after have a heavy drinking and overeat indulgence after the party, and without very strong digestive functions as a precursor. Now, after middle burner pattern, here let's have a look at lower burner patterns. So up, middle, lower burner. Much more further. So upper burner is a less severe one. Middle burner is more severe than upper burner in general. Lower burner is most severe and later stage of triple burner pathology in general. So these all involved organ of kidney. So here talking about kidney and patterns or syndromes here. Upper kidney patterns, fever is not going to be exuberant. So that means you do not hear about very high temperatures. Instead, they feel hot and it's early in the late afternoon or at night. But this kind of temperatures never more than 39, 40, it's about 38, around that kind of levels. Sometimes it can tell you their palm, their sole, the chest feels so hot, can wake up with all the sweating on their chest. And their mind is very difficult to be settled, very agitated, have enormous complaining about the thirst. Their lips usually shows very, very dry, hydrated. They complaining, and their tongue has been stick, the lining of the mouths, if they don't drink any liquid at night. So enormous dehydration shows out. Also dried throat can come out, and even husky voice can come out at night. And some of very severe conditions, the hearings even can be affected. A dry atrophy also can present on the tongue body, shows a lot of dehydration, and the tongue usually shows very deep and the dull red, crimson red, very dehydrated, multiple cracks. Pulse, due to serious dehydration, pulse very, very thin, very deep, submerged, very hard to feel. They could be slightly rapid, but lack of force. So they don't have very strong force. So up to this level of the Wen Bing conditions is very, very severe. These pattern conditions are quite similar like of terminal illness conditions, and the treatment could be similar. So that's why some people using the lower burner patterns treatment formula to deal with end of stage of even the cancer in the stage of kidney pathologist conditions, using similar formula to deal with, even they don't have any kind of external and Wen Bing pathologists involved. They can use a similar formula to deal with similar conditions and can help minimize suffering and relieve symptoms. Now, correlated with the liver in the lower burner, correlated with the kidney in the lower burner is the liver. So here have a look at liver pathology. And both liver and kidney pathologists, we know in the internal medicine is quite severe conditions as a kind of latent syndromes clinically, same in the Wen Bing. When the liver becomes disordered in Wen Bing suffering, and they're going to have something very, very unpleasant. So one is disturbed, the wind will comes out, unnecessary or unexpected spasm and twitches comes out, and some even like seizures will come through. And this is due to injury and consumptions of the water molecules in the water element in the kidney yin and the liver yin or liver blood. So they are always agitated. They can have lipid hallucination-like conditions. They do not rarely see things clearly. So a lot of unnecessary movement for the eyes, for the bodies, for the muscles. The hearing can be affected due to insufficient gene from the kidney to nourish it, and still feel hot, clammy on the hands, the palm, and sole, and even on their bodies. When they're sweating, and their sweating usually could be very salty, very steep, some even a bit oily as well. And the palpitations usually very, very scary because very pounding, fasting, looks like a jumping out of bodies, that calling for rescue, for help. Trembling fingers and the chronic convulsions could happen as well as the dried, very shrink, dehydrated tongue. Looks like somebody just used the vacuum machines, trying to, causing size change of the tongue, and very, very deep crimson and red looking tongue can comes out, and some of the tongue looks like piece of the liver, and very, very unpleasant. The pulse usually very, very weak, frail, on the verge to expire. So very, very weak pulse. They don't have any ability to struggling. So pulse is very, very serious conditions. Multiple cracks is very common happen with serious dehydration, yes. Now, based on theoretically, progression of illness usually come from mild condition to severe conditions. So that means based on Sanjiao theories, and Wen Bing comes from upper burner. If they can be resolved, go to middle burner. If they cannot be resolved, go to lower burner. But in upper burner, if they cannot be resolved, affect to pericardium. If they still can be resolved, we go to the heaven. Yeah, whatever we go some other world. But up to pericardium channel, if they can be resolved, they may go back to normal Qi levels or Wei level in the lung and slowly ventilate out. If problem cannot be resolved in the Qi Wei level, organ level of the lung, they go to middle jiao burner. And middle jiao burner conditions could also affect it directly by external pathogens from food combinations, whatever the bacteria virus involved. But the lower jiao disorders usually is always come from unresolved middle or upper burner conditions. It's not very common come from lower jiao disorder straight away from external attack. Not very common. Maybe sometimes or some stage we have very serious pathogens, very strong pathogen comes out, can affect it, result in lower jiao disorders. Now, any questions so far? If we do not, we may go and have a 15 minutes break and come back after 50 minutes. Is that okay? Okay, stop the recording now.